All right, guys, so in the last video, we took a closer look at GMP, good manufacturing practices, and talked about the FD&C Act and the amendments that happened a little bit later on. But once more, it's more than just pharma. It is anything food-related, drug-related, cosmetic-related. That's going to fall under this manufacturing side of the house for sure, under Title 21 of the CFR. All right, so a couple of golden rules here that we need to list for good manufacturing practices. So let's say that I'm a company and I want to make a product, and we want to make sure that we follow GMPs as they are intended to follow. So what are some of the things that we would look at company-wise to ensure that GMPs are going to be followed? Here are the top 10, all right? So number one, we are going to make sure that the facility is actually designed the proper way. Believe it or not, these companies do build buildings that have one job to do, and that one job could be make some hot dogs. So that building is going to get designed in a way where we can ensure that good manufacturing is going to be followed as far as GMPs go once we get that product launched and once we start making it. So facility design is going to be a big thing, but very often they do this from the very beginning and they build it from scratch. Very few times do they just rip out everything in an existing building and build all over again. It's actually sometimes more expensive to do something like that than it is to actually just go ahead and start up a company or build a new building to make a new product with. Number two is to validate the process. So validation is a key word, and we're going to talk about validation at a different time. But to validate something, you're just double checking it. You're making sure that it's doing what it's supposed to do, and you're giving it the check mark, and you're saying, yeah, listen, I don't see a problem. Keep this up. You're doing great. Just keep it up over and over and over and over and over. All right. Next up, number three says write good procedures and follow them. So this is more like SOP type of category here. The auditors, when they look at GMP requirements, they do go in and look at SOPs and look at your methods that you follow. And they want to make sure that you are following them as they're written and as you are given training on. So SOPs are going to be things that you're going to get scrutinized with on the manufacturing side as well as the laboratory side. Number four, identify who does what. Certain people should have certain jobs, right? Their jobs should be clearly detailed. They should have no question about what their role is at the company or what they're going to be doing for that day on the manufacturing side of the house. So this is your job. This is how you do your job. And this is why your job is important. And you hope that your employees will understand that and be able to talk to an auditor to make sure that they can convey that message across. Next up is keep good records. So just like what we saw prior or previously, record keeping is going to be a must. And the GMP side of the house is not out of that ballpark. They are just as much in it as the GLP side of the house. So all of the testing that's going on, all of the record keeping, the ingredient list, the testing, the data, the results, what did you find, the log books, the training manuals, all of those are going to be reviewed by auditors on GMP side. Number six, train and develop staff. So training is going to be a thing just like it was on the laboratory side. We do want people properly trained. We want proof that they've been trained, and we have documentation that shows that. It can't just be word of mouth. You actually have to prove that that person knows what they're doing as far as their job goes. Number seven, practice good hygiene. Again, you don't want people coming into work that's not taking a bath in a month or that, are not wearing the appropriate clothing or the beard covers or the hairnet covers. You want to make sure that people don't have jewelry on because that could get hung up in the mechanicals or the instruments that they're working with and rip off their fingers. So those are the types of things that you want to include in good hygiene. So you want to make sure there's a plan in place, like what's acceptable, what is not. The employee, which would be us at a certain point in time, we have to make sure that we follow those rules, because if we don't, we violate GMP. And if we violate GMP, then that product violates GMP, and that could be yanking from a consumer shelf. And all of a sudden, you've cost the company multiple millions of dollars just because of that recall that could happen. Number 8, maintain the facilities and the equipment. So I talked a little bit about this when we watched the hot dog video, right? This is kind of like our laboratory setting. So we want to make sure that someone comes in and looks at the building, looks at the roof, looks at the floor, looks at the discharge or the waste, electrical, all of it, right? We want to make sure that there's no holes in the corner that huge rats can come through or huge snakes can come through and get wrapped up in the hot dog manufacturing line. I mean, that's just part of it, right? So with these auditors, they are not just simple laboratory sciencey people. These auditors will include everyone from people that are experienced in construction, electrical, plumbing, yes, sciencey type of people, but it's going to be a group, and that group is going to represent everything that they're going to be looking for. And that does include the facility, building, grounds, and equipment. Number 9, build quality into the entire life cycle. That's also something that they are encouraged to do when they manufacture a product. What this means is that from the ingredient side of the house, how are you ensuring quality? And then all the way to the finished product, which is put it in the bottle. So the bottle to the label, to the film, to the cotton that goes in the bottle, maybe, whatever the case is, everything has to be double and triple checked. So build quality into the life cycle. That is what this is all about. And number 10, which is kind of the biggest, and this is perform your own audits. So when you're working for a company like this on the manufacturing side of the house, they will often encourage you to do your own audits to make sure that you're finding mistakes before real auditors come in and write you up or cause trouble for the company as a whole. So with that, this is what we would regard probably as the QA and the QC department. So the QA or the QC would go around and they would swab those pieces of equipment. They would take samples of the products along the manufacturing line. They would take those back maybe to a lab environment. They would do some testing on them, make sure they all look good before that product is actually released. So they are testing the product, but they're also testing everything that comes in contact with that product as well. So perform regular audits. That's a big thing that companies need to do internally. Absolutely. All right. With that said, that's going to lead us into something called SISPQ, or something that we would say CISPQ. Ooh, right? That's another one of those moments. Ooh. All right. So CISPQ is going to be safety, integrity, strength, purity, and quality. So this is the abbreviation that we are giving for all of those key terms that we showed, or that I showed, in the FD&C statement. These were the bolded words that I said, these are the things that need to be upheld: safety, integrity, strength, purity, and quality. So kind of the shorthand abbreviation here is CISPQ. So if you can remember that, then you know what those key terms are supposed to be. So CISPQ. So GMP, again, helps maintain CISPQ. That's what we're after. GMPs, once more though, is more than just drugs. Even though I use pharma as an example many times, it's more than just drugs. So over-the-counter drugs are going to be included in this, as well as prescription drugs. Veterinary drugs are also part of this as well, right? Because we want CISPQ to be part of anything that's going to be given to your loved one at home, whether that's a dog, or whether that's a cat, or whether that's a goldfish, or goodness gracious, whether that's your husband or your wife. Clinical studies are going to be part of this as well. So CISPQ has to be upheld in clinical studies. So these products are going to be given to study groups, and we're going to monitor those study groups. We're going to look at their health. We're going to look at what goes on, whatever the case is, and then food products as well. So hot dogs, but any type of food product that gets manufactured, There's going to be some part of GMP that's going to be present. All right. Okay, so what happens, though, if CISPQ falls out of line or GMP is not really getting performed? Things are not conforming to what we would like to see. So what are some of the things that go on with that type of scenario? Or if an auditor comes on board and they write up this report and they're like, oh my God, we're going to get shut down because look at all the things they found. That's not necessarily the first thing that goes on. So there's a couple of stages here, and there's a couple of moving gears that can happen. One of the first is what we call an FD 483. And a 483 document is almost like a summary document. That's what this is. So let's say that I'm working for the hot dog plant, and I'm making those nice, juicy lip and butthole sticks, and an auditor comes in and they find a problem. They might not tell me as a worker what that problem is. And they also might not tell some of the manager staff or the administrative people at that company what some of those problems is at that time. What's going to happen is that those auditors are going to go back and they're going to talk to each other because there's a group of them, and they're going to come out with a summary report. And that summary report is going to be the FD 483 or the what we call just simply 483s. So this is a summary of their findings that they have discovered why they were at that manufacturing plant or at that facility. So that summary is provided to the owners, the managers, the administrative people to be like, listen, these are the problems. These are the red flags. This is what we find. So we would like for you to respond to these, and we would like for you to tell us how you're going to fix these problems. So that is the purpose of the 483. All right. Everything else that you see under that, the warning letter, the product seizure, the audit observations, the consent decree, and the loss of license to operate, all of those are going to happen after the 483 is issued most of the time. So 483 is going to be like, hey, here's a warning. This is what we found. We need you to fix it. If you don't fix it, these are some of the other things that can happen to that particular company on the manufacturing side of the house. The warning letter will be like, no, this is not appropriate. No, your response is not good. No, we still need more information for you to do something. Here is your warning. We need to talk about this. This has become a serious issue, and we need to address it immediately. The product seizure is the idea that this item, whatever that might be, that has been produced and sold to a consumer onto the consumer shelves, that product is going to be recalled, or the product that is holding in the warehouse at the company is going to be recalled in a way or not be approved to be released and sold to a consumer. No one wants that because that's massive a loss of money, because all of that product is deemed inappropriate as far as GMP regulations are concerned. The audit observations are going to happen as well. So after you respond and after you follow up and you're like, hey, this is what we're going to do not be surprised if the auditors come back out, maybe unannounced, maybe just out of the whim, and be like, hey, we're here today. We would like to see to make sure that you're doing what you're supposed to be doing and that these problems got fixed. I want you to think of this as almost like the health department coming out and observing these restaurants on how they cook and how they handle your food. They're going to do quite a few follow-ups over a course of time, and that's part of it. So auditors will come back out. They will make sure that things are fixed, things are going in line like they should be, and if so, you get the check mark and you keep going. Next up is the consent decree. A consent decree is the idea that you have an agreement and you do not have to go, oh Lord have mercy, and you do not have to go to court in order to fix these problems. So the company has stepped up and the company says, listen, I own these mistakes. I know they're problems. I know they're our fault. And the auditors or the regulators say, yes, it is your fault. I'm glad that you admit it. So let's not go to the court. Let's not get lawyers and judges involved. Let's just come to a consent decree, meaning that you are taking the responsibility, you take the fault. This is all falls on your lap. And that's what this is all about. And it's going to be a quick and easy fix for you. Saves a lot of money, saves a lot of time. Next up is loss of license. So if at a certain point you do not uphold GMP standards and your violations are never fixed or corrected, then these auditors, wherever they come from, can make you not produce the product in form of the loss of license to operate. So they cannot shut you down. That is a misnomer that people think. They cannot shut you down. So they cannot tell a company, close your doors, you're locking it up today, because they don't own that company. They don't have that jurisdiction. They cannot do that. But they can at least go to that company and say, we worked with you, you didn't listen. Because of that, we are going to pull the license away so you cannot make that particular product anymore. If you've got other things going on at your company, those might not be affected. Make those, test those, have the laboratories running, but you cannot make that particular product because we have deemed you not following GMP standards and regulations. That's what this is all about, all right? So the other things that these regulators can do is that they can mess with your clients and they can mess with your money quite a bit. So with that said, they can also target your business aspect and the legal aspect as well. So they can actually touch base with the company's clients or customers that are paying your company money to do a job for them, and you're doing that job for them, right? So those companies want legit data. Those companies want real products that follow CISPQ. And because of that, the regulators can contact those customers and clients, and they can say, listen, these are our audit findings, and we would like to share those audit findings with you. And we would like for you to know that these are the problems, and we gave them a chance to address those problems, and they have not done that yet. Or they did do it, but it took them quite some time in order to do it. That also damages the company's reputation. So when word gets out that that company is in fault, then it makes clients and customers in the future second guess their work because they've heard horror stories. So think about hiring a plumber, and that plumber's came out, and instead of making your sink drain the proper way and getting rid of a clog, water's now shooting up from your toilet and it's hitting the ceiling. You probably would not use that plumber again, right? And you probably would tell other people not to use that plumber again because they do shoddy work. The same thing's going to happen here with these laboratory and production plants as well. The other thing, and finally, that I'll talk about here are the legal aspects of it. So they can get courts involved, and those courts and lawyers and judges all come with a price tag, and that can lead to fines, which could be massive amounts of money. Or if the violation was bad enough, it could actually lead to prison time. And the prison time can go to the owner of the company, or the managers of the company, or the actual workers of the company. So if you were working at a facility on the GMP side and you were doing something that you weren't supposed to be doing and you knew that it was wrong, but a boss told you to do it anyway, that could be in violation of GMP. And if that violation is bad enough, you are held as responsible as the managers and owners of that company because you deliberately did things knowing that they were not proper GMP protocol. So therefore, you could face prison time if you are one of those unlucky ones that get caught. So just don't get caught. Or better yet, don't sign off and don't do things that you're not supposed to do just because they want this product out on market so they can sell it and make some money. I mean, I hate that it's an inconvenience, but if GMPs were not followed and someone finds out about it, well, this could lead to a loss of a job altogether, or you be put in prison because of those mistakes that were done. So don't be that person. So this is where I'm going to stop this video. We've got one or two more on GMP So we'll finish those out and maybe take a break, finish some of those assignments that are GMP related, and then we'll pick up from there. But we're not quite done with GMP yet.